Hello and welcome to episode 19 of the Lymphatic Massage Therapist Book Club. We're looking at chapter 19 of High Definition Body Sculpting, and this is definitely one of my favorite two chapters in the book. It's the one that focuses on postoperative care. So what I don't want to do is have this video be 20 minutes, which it really would be, because the honest truth about this chapter is I should just sit here and read you the whole entire thing. Every single word in this chapter is specifically focused for the needs of the lymphatic massage therapist who's helping these clients after surgery. So what would I say? If you are trying to talk to a surgeon who does not know about manual lymphatic drainage or other types of recovery postoperative care that you can offer as a lymphatic drainage massage therapist, definitely it's worth your while to grab this book and look at chapter 19, and then you can just quote extensively from it, because this is not, our opinion. It's not my opinion. It's not something you found on the internet. It is a publication. It is a textbook by surgeons for surgeons. So let's just look overview really quick. So it focuses on treating the signs and symptoms of post-surgical bruising and edema, monitoring and promoting the healing process, preventing and treating fibrosis, adhesions, undesirable scar tissue, ameliorating visible scars, hypertrophic scars, and keloids, providing continuous care, advice to the patient to optimize healing, and identifying complications. Some of the subheads talk about drainage. They talk about the different types of massage that can handle drainage. And again, just to know, if through my personal board certification, I can't do the initial type of drainage massage that they talk about. But I can do, and I am trained in manual lymphatic drainage. They also talk about compression. They absolutely talk about foam dressings, and they even show the foam dressing that they use underneath the compression garment. Interestingly enough, when they talk about compression, they talk about how it shouldn't be too tight after plastic surgery. And this is at first I was like, oh, that's really interesting, because what I see too often in my clients is they have compression that's absolutely not tight enough. It'll be at 4 or 5 millimeters of mercury, but it will be constricting, like a pantyhose that's absolutely not tight, but it just feels like you're trapped inside of a pair of pantyhose. And so people will think that tightness, that constriction is what they need. And then so I will see in my practice that people will try to squeeze themselves into a compression garment that is far too tight for them, because maybe they're looking for the size on the back of it. They want to go from the medium to the small to the extra small. They want to go to the 2X large to the extra large to the large, and they will sacrifice their foams and just wear only the compression garment because they really want to look smaller after the surgery. They paid a lot for the surgery. They were told by many surgeons will say your recovery is 2 or 3 weeks. They're looking at other pictures on the internet, and they're seeing these other people who have had liposuction or are smaller at the same amount of weeks after their surgery, and they're kind of just really focused on getting into a garment that's too small. So what I do is I will ask 2 questions to someone of their garment, and I'll also measure it. But if they come in without a garment, or I'm talking to them and I cannot measure their garment, I'll say, can you eat a full meal, and can you take a full breath? And if people are eating only just a little bit at a time, they find themselves getting full a lot sooner, to the point where they can barely eat, more than a third of their regular portions at a time. I say, or definitely if they can't take a deep breath, if it's so tight in the thighs that they're getting swelling in the feet, if it's so tight in the arms that they're getting swelling in the hands, that is a garment that's too tight. So I do agree with the authors. It has to be moderate compression. You cannot just think that you are going to only put a compression garment on after surgery and squeeze the living daylights out of yourself, and that's how you're going to get smaller. So I agree with the authors on that. So let's look at the care system of postoperative care. This is actually how I first learned about this author, because this system was mentioned in a paper that was recently published in PRS, the journal, the Plastic Reconstructive Surgery Journal. So the cosmetic active recovery system is designed to accelerate healing in the postoperative period and shorten the recovery time for the patient. And it's a regimen that the surgeon puts his clients through. It's listed on page 211. And some general effects of they talk about what the care system does, and then they talk about the treatment protocol. So it includes manual lymphatic drainage, external ultrasound, pressotherapy, which is intermittent pneumatic compression, diathermy, radiofrequency, wet heat, and other energy-based devices. And then they go through the explanation of each of the different types of their care system of postoperative care. So there's actually an entire page, 2 pages on manual lymphatic drainage, which provides a really good explanation of what manual lymphatic drainage is. If I was going to talk to a plastic surgeon about what I do and maybe how it's different from what they might see on the internet and be scared that they would get their clients into, because a lot of people are using the term manual lymphatic drainage and not meaning the type of massage that we mean, that we do. This is really a good explanation. It says most contemporary MLD techniques are based on the techniques originally pioneered by Emil Vader in the 1930s. So it talks about that. And then it will go on. It talks about external ultrasound, pressotherapy, other energy-based therapies, and they're talking about like vela shape, whatever, smooth shapes, XV, extracorporeal shockwave therapy, just a little bit about those, and then diathermy, wet heat. Wet heat or moist heat is used in physical therapy to induce vasodilation, improve blood flow to tissues. So we've all had experience with wet heat, treating it after an injury. So this is a very easy thing that we can incorporate into our massage. It's like hot towels. How is moist heat, and then they finish it off with just some information about carboxytherapy. And then the conclusion is the purpose of a thorough postoperative regimen in patients undergoing high definition body sculpting is to avoid complications and optimize the aesthetic result. In the immediate postoperative phase, blood-tinged tumescent fluid is evacuated by compression and open drainage. And after 2 to 3 days, manual lymphatic drainage commences in order to accelerate healing. So that is that is their conclusion. And then I would just, this is the chapter for me that kind of started it all. I really like every single detail in this chapter. This is really good education for if we have to talk to surgeons, if you have a newer therapist that maybe has learned the lymphedema therapy but wants to know how they can apply it, or from a textbook perspective, how it is how MLD is involved in post-operative care without getting into any details or any specific protocols, but just wants to know more about, like, is it an option? Can I actually, how would I fit the MLD skills I already have into if I'm getting these clients after liposuction? So excellent chapter, and I look forward to seeing you in a future episode. Thanks.